Okay, good morning, everybody. Today is July 7th. This is the Anchorage Emergency Operations Center operational update. Situation, go ahead.
Good morning. Today is day 490 of our response. As currently reported, locally we are 103 cases since the last report a week ago, up 1 death and 9 hospitalizations. Statewide, up 178 cases, 3 deaths and 13 hospitalizations. Next slide. For 213 resource requests, we filled or otherwise satisfied 1,778, an additional 8 since the last report, with 23 currently working. Next slide. In the congregate shelter, there are 289 clients. That's down 21 from last week. And the non-congregate shelters, 358 clients, up 1. 647 clients in all shelters, down 20, averaging 1,941 meals per day. Next slide. In the last week, at the visit testing sites, there are 1,412 sample collections performed. And in the last week, at all pods, 488 doses administered with 80,341 to date. And report.
Thank you, Situation. Weather, go ahead.
All right, thank you. Good morning, everyone. So looking at the forecast for today through the end of the weekend, it's going to be more of the same, mostly cloudy with a chance of showers each day. Today I'm actually seeing a little bit of sun break through. We had that low pressure system move through yesterday. It's actually departing our region to the east, which is why we're seeing some more sunshine right now. But in the larger scale picture, expecting this long wave trough to move over us over the next 24 hours, which should see at least a chance for some scattered showers later this evening into Thursday. A lot of that will be confined to the hillside. Overall, our temperatures are expected to remain in the low 60s. And then as this long wave trough moves out through the end of the week, it quickly gets replaced by another trough over the weekend. So that chance of showers will continue at least into the early half of the weekend. Saturday it should start to move out on Sunday, and with that, maybe some warmer temperatures on Sunday with maybe a high near 70 degrees and more sunshine with just a more isolated chance for showers later in the day on Sunday. But really nothing impactful, and otherwise just a continued chance of scattered showers, but nothing real significant over the next few days.
All right, thank you, Weather. Testing vaccines, go ahead.
Good morning, everyone. This is Pat Ryder, Emerging Infectious Diseases Assistant Program Manager. Today with testing, Visit Healthcare had an increase of 7.40% over the previous 7-day sample collections, and our community cases are continuing to rise. As of July 1st, our estimated daily growth rate is 4.65%. Our 14-day average reproductive rate is 1.249, and our 14-day average case rate is 6.37 for every 100,000 residents. And our current alert level is intermediate. With vaccines, Visit Healthcare clinics had a decrease in average daily vaccinations of 26% for the previous week. The Alaska Airlines Center has stopped operating as of June 30th. We do have a new clinic up and running at the New Commons Pier 1 to begin operations on Friday, July 9th. For upcoming pop-up vaccine clinics, on Friday we have the Anchorage Cider House, Green Grouker, and the Fifth Avenue Mall. On Saturday we have the Lusac Library, the East Anchorage Rotary Food Pantry, and the Fifth Avenue Mall. And on Tuesday we have the Spenard Rec Center in Unique Inc., Alaska. Just a reminder, we do have mobile vaccine clinics that can come to you wherever you are, be it a business, church, or other organization. For more information or to schedule, please dial 907-531-5100. Next slide, please. So with regards to messaging from the Anchorage Health Department, as mentioned, our overall risk level is intermediate. This is evidenced by the increase in cases for the municipality to a rate of 6.37 per every 100,000 residents. That said, with approximately 55% of eligible residents ages 12 and older and 58% of residents ages 16 and older having completed a COVID-19 vaccination series. Anchorage currently comprises two subpopulations with very different COVID-19 risk profiles. Unvaccinated individuals currently experience a risk for COVID-19 infection equivalent to an average daily new case count of approximately 10.4 for every 100,000 residents, while their unvaccinated counterparts experience a risk equivalent to 1.04 for every 100,000 residents. Our consensus reproductive rate of 1.249 is higher than last week's consensus estimate of 1.06. Just a reminder that a reproductive rate above 1 indicates that the virus is continuing to spread. Finally, we are continuing to watch the following community factors which may increase COVID-19 risk within the municipality. These include an increased prevalence of more transmissible variants of concern, to include the Delta variant, a very slow increases in vaccination coverage, minimal use of non-pharmacologic interventions, including masks and social distancing, despite more than half of the total population not being fully vaccinated, and higher numbers of travelers to Alaska for both employment and tourism. This concludes testing and vaccines. Barring any questions, end of report.
Thank you, testing vaccines. Contracts and logistics. Go ahead.
Good morning. This is Wendy Reese reporting for contracts and logistics. Our mass care report is we're still continuing to wrap up the contracts that were approved during the 622 Anchorage Assembly meeting and to continue our mass sheltering support through 9/30. Testing and vaccine support. COVID testing contract bids are due back today, 7/7, and our current contract with visit testing is extended through 7/16. Vaccination contracts and modifications were still to improve overall vaccination capabilities throughout our community. We're ongoing staff adjustments to meet our COVID mission requirements with our personnel. End of report.
Thank you, ma'am. Finance. Go ahead.
Good morning. This is Audrey Jo Malone reporting for Finance. Current encumbrances as of today, July 7th, are $23,494,203. Actual spent to date for the incident is $64,524,423 for a grand total of $88,018,626. We are, of course, currently seeking cost recovery for expenses by way of federal funding, and please continue to submit invoices and supporting documentation to eocinvoices@anchorageak.gov. End of report.
Thank you, Finance. Safety, you're up.
Good morning. This is Annalisa Roberts reporting out for safety. So it's summertime in Alaska and people like to get outdoors and do different activities. So here are just some safety tips for doing that when you are traveling. Before you leave, check the weather report and have an emergency plan with you. Look for weather if it's inclement of 500 feet, if clouds are less than 500 feet above the ground, fog is really thick, and excess winds. Consider changing your trip and going a different time when the weather isn't so severe. Packing an emergency kit, taking emergency supplies such as a knife, waterproof fire starters, personal shelter, and a whistle, also a GPS and a map. Let someone know where you're going and when you can expect to return. Even if you can't give them the exact location, let them know what area you're in. So if they don't hear from you, they can start a search party. Make sure members of your group have adequate clothing and footwear. And if you're staying overnight, arrive early to be able to check your campsite or get your boat docked so you can make sure it's in a safe location. Avoid areas of natural disaster. So in the rising tides during the night can flood a campsite if it's built too close to the water. And also be aware of the periodic high bore in South Central Alaska and the mudflats. Take drinking water with you or purify stream water, following the directions on the pack. Build fires in a safe area and make sure your fire is completely ignited when you go to bed at night, and never have a fire or anything that can spark in the tent if that's what you're staying in. Try to prevent dangerous wildlife encounters. So when you get to your site, make sure there's no tracks or anything that shows that they were there. And if they have been there, they probably are very close still. So try moving to a different location and practice good hygiene. End report.
Thank you, Safety. Public information, go ahead.
Hi, everybody. Public information is continuing to message to our community about the importance of vaccination, especially as we continue to see case raises rise within Anchorage, and also the importance of continuing to get tested if you have symptoms of COVID-19 or have been exposed to somebody who has tested positive for COVID-19. We also are promoting our vaccination clinics. We're doing that through social media, daily email, and flyers. And we are beginning to explore some new ways to get the word out there to really make sure that everyone in our community who wants to get vaccinated knows where and when they can get vaccinated. And we're continuing to coordinate for our final Sleeves Up for Summer event at the Northway Mall, which will be held on 7/31. End of report.
Thank you, public information. Liaison, go ahead.
Good morning. This is Drielle Welch, filling in as the liaison officer for the Anchorage EOC. Thanks to all of our partners who are able to join us today. Do we have any partners or cooperators that would like to report out? Okay, hearing none, let's get started with our hospitals. Next slide, please. All right, Alaska Native Medical Center. Kirsten, are you online?
Good morning. This is Kirsten Kolb at ANMC. This morning we have 5 positive inpatients. 3 of them are in the CCU, 2 of them are ventilated, and we have 0 PUIs.
Thank you. Alaska Regional, Sean, are you online?
Yes, I am. Good morning. Alaska Regional Hospital has 11 total COVID patients. 9 of them are in isolation. 3 are in the ICU. 1 is a vent. And of note, those numbers represent a 50% increase from last week, which was a 50% increase from the week before.
Thank you, Sean. Providence, is Michael on since Nikki's on leave? Okay. And Kara mentioned she may not be available from Matsu, so they reported their numbers out this morning. They have 0 COVID positive patients, 0 COVID positive in the ICU, 0 on a ventilator, 0 PUIs, and 0 COVID recovered inpatients. And then for the 673rd, they were unable to make it this morning, but they did provide numbers. So total first dose on vaccinations, 10,579. Fully vaccinated, 9,662, for a total doses of 20,241. And I can put those in the chat as well. And that's it for liaison.
All right, thank you, ma'am. As a reminder, our next operational update briefing will be 10 a.m. on the 14th of July. Everybody have a great day.